Setting up a sterile tray is just as important as performing the procedure itself. Most people at some point in time are going to have a procedure that requires the use of a sterile tray. As a healthcare professional, it's my responsibility to make sure that proper sterile technique is followed. So today I'm going to show you the basic steps in setting up a sterile tray. First, you're going to gather your supplies, then you're going to open your tray, drop your supplies on the tray, put on sterile gloves, and then handle and organize the supplies on the tray. So I've gathered my supplies. I've got a syringe. You might need needles or any other supply that the doctor deems necessary, and a pair of sterile gloves. So to open up a sterile tray, you're always going to open up the flap that's furthest away from you first. Then you're going to open the side of the tray. And last, you're going to open up the one closest to you. All the while trying to keep the flaps from folding back up onto the tray. Okay. Now for those extra supplies that are not on the tray, you need to open them up and then drop them on the tray sterilely. So you need to open up the package without touching the package, and then you're just going to drop it on to the tray like so. Resist the urge to touch the tray. I think we've all seen people who want to just go ahead and start setting up everything like that. But what you have to do is you have to put on some sterile gloves. Now, to put on sterile gloves is kind of tricky, but there are certain guidelines that you have to follow. You're going to open up the tray or the flat like that against the surface. Now, with your dominant hand or your non-dominant hand, you're going to reach in for the inside cup of the glove, slip your hand into the glove, and only touch the inside of the glove with your hand. Then you take your glove hand, slip underneath the cuff of the other sterile glove, and watch your thumb because your thumb might get contaminated with your hand. Keep your thumb away, reach in, and slide on the glove. And keep your hand underneath so you don't touch your skin. Now that the gloves are on, you can pull them up and get them comfortable. And according to a recent article in the AORN journal, they state that you need to change your gloves every 90 to 150 minutes when they become contaminated or loose. So now that your gloves are on, you can set up your tray and handle the supplies. So you would just get your drapes out, get them in an organized fashion. Some trays are different. You're going to put your supplies in the same place every time because once the doctor reaches for the supplies on the tray, you want to have them in the same place. So organize your supplies. And then you just need to discard any trash or any material that you don't use during the procedure and get that out of the way so it doesn't become an issue. So now, once the tray is set up safely, it's okay to use for the procedure. And to recap, what you need to do is gather your supplies, gather your gloves, open up your sterile field, drop your supplies onto the tray, put your sterile gloves on, and then organize the supplies on the tray. And just remember that it's everyone's responsibility once the tray is open to maintain the sterility of the field. Thank you. Let me just show the audience again.